two.
Good afternoon. Thank you for allowing me to present my proposal for the Compassionate Primary and Women's Healthcare Clinic. I envision this clinic to be located on the Midlothian Hull Street corridor of Richmond, Virginia, which has been designated a physician shortage area, a medically underserved area, and is characterized as a medically underserved population by the Bureau of Primary Health Care. The City of Richmond has also designated this area as an area of revitalization and has committed to offering incentives for business development. The concept for the center was devised by myself, Seabrook. I am a certified women's health and family nurse practitioner with over 17 years of experience working in private physician practices, community and public health agencies, and hospitals. The mission for our center will be to provide high-quality, compassionate, comprehensive, individualized, patient-centered care that is affordable and accessible. We will emphasize the human connection in all of our interactions with our patients, and the center will be faith-based and nonprofit. The services we intend to offer include preventive services and chronic disease management. Minor, acute, and episodic care will be provided, immunizations, well woman exams, STD testing and treatment, contraceptive management, and health education and counseling. We will not provide obstetrical services. Richmond has a population of 217,853 people, according to the U.S. Census Bureau 2014. 50% of this population is African American, 44.5% Caucasian, and 6.4% Hispanic. The city is predominantly Southern Baptist, which will lend support to the fact that we intend to be faith-based. The city, along with the cities of Petersburg and Charles City County, have the highest rates of adults diagnosed with diabetes in the state of Virginia. And Virginia itself is at the seat of the stroke and diabetes belt in the South. Our disease percentage, or what we want to concentrate on, the diseases include, but does not eliminate other diseases. We intend to emphasize cardiovascular treatment. 40% of our treatment will be geared toward hypertension and heart failure. Diabetes 25%, asthma 5%, obesity 5%, and women's health care 25%. The center will offer transportation health services, case management, and specialty referrals. Our payer mix will include Medicare, Medicaid, fee-for-service, that will equal 30% of our population. Medicare, Medicaid, MCO will represent 35%, private insurance 15%, sliding scale self-pay 20%. We will anticipate that our staffing will include 1 contract physician, 2 nurse practitioners, 1 registered nurse, 1 social worker, 1 clinical director, 2 medical assistants, 1 lab tech, and 1 receptionist. The contract physician will be available to see complex patients on consult and collaboration, but the center will be an advanced practice nurse-led facility. We anticipate that the clinic will have a potential 2,500 patients enrolled by the end of the first year. And we will have the contract physician potentially see 1,000 visits or encounters the first year, and the 2 nurse practitioners a minimum of 2,100 visits each the first year. As far as our income, we have applied for grant money from the Virginia Healthcare Foundation of $200,000, and we have applied to the Public Service Act grant 330 for $350,000, and we anticipate a small business loan of $30,000. Now, we do anticipate a $30,000 startup cost. For our Initial total employee expenses, we anticipate that to be $852,971, and the non-employee expenses to be $49,488, plus the $30,000 startup cost, for a total non-employee expense of $79,488. This gives our total operating expenses the first year of $932,459. However, less our total operating expenses the first year of $932,459. This leaves us with a surplus the first year of $152,000.17. Calculating those same rates and considering 3% inflation, we hope to continue to see a $1 million income, and the second year, $69,000 in profit or surplus. I'm not saying, excuse me for using the word profit, we are a nonprofit organization. And our third year, our total income again will be $1,105,000, and total operating costs projected at approximately $989,000, and we will see a surplus of $116,000 if all income comes in. We expect to have our loan paid back, the $30,000 loan paid back by September 30th, 2018, because we have contracted to pay that over a 3-year period. Again, I think this is a very viable, if you look at the numbers, this is a very viable business opportunity and a very needed service in this underserved physician shortage area. The Kaiser Foundation did a survey and found that even with all the physician shortage areas and the number of primary physicians, there is still a 72% deficit or shortage of physicians in this shortage area. And so there is still the need, there is still some unmet needs out there that someone needs to address. And in this particular area, we're hoping that the Comprehensive, Compassionate Primary and Women's Health Care Center will help to provide those needs. Thank you very much.